Roy, welcome to your very own Art of the Possible festival as part of Fab Changes 22 to 23. And you're going to be sharing with us your top tips on how we facilitate sharing and best practice to improve patient experience.
That's cool. Thank you, Terry. Thank you very much. And greetings, everyone. It's lovely to see you all. And if you're watching if you're watching a recording of this, I'm afraid you won't be able to win the prize for 2 first-class tickets for a holiday, 3-week holiday in Barbados. Right, greetings. It's great to see you all. Thank you, and thank you very much. It's great to be part of this this great festival of doing good stuff. I'm talking about sharing best practice and how you facilitate it and all the rest of it. And for me, you know, the whole thing really starts with an attitude. And I've got till 1 o'clock, so I'm going to kind of speak for till about 10 to 1, and then we can have a conversation, because you might not agree with what I'm saying, or you might have better ideas. But I just want to kind of begin where this all began for me and for Terry, the Academy of Fabulous Stuff. It started a long time ago now, where a trust, it doesn't matter which one it is, but it got itself into a terrible mess. And the upshot of it was that some people who were supposed to have chemotherapy didn't get the chemotherapy, and some of them died. Now, we don't really know whether they died because they were very sick and they were going to die anyway, or whether they were very sick and they didn't get the treatment they needed. But fundamentally, they didn't get their chemotherapy. The police were involved. It was a huge drama at the time, and obviously very worrying. The chief executive of the trust, who was a really good bloke, actually, he was a doctor, and a doctor in management, you know, they're often very effective, but he quit, and the chairman stood down as well, and it hit the headlines. And when they did the investigation to find out what went wrong, the upshot of it was, I mean, you know, put in basic language, the management of the trust knew they were under pressure. They'd had a bad rating from the CQC, and they knew the CQC were coming again. And so they knew that they were behind in giving chemotherapy to their patients. And so they did the most stupid thing that is possible to do. They falsified the records. They actually changed the records to make it look like they were up to date with chemotherapy. Now, they did that because they were concerned that the CQC were coming to inspect and they'd be caught out again. And I remember thinking at the time, you know, what is it that turns good, honest people who come to work with a strong sense of vocation, just like you did this morning when you got on the bus, in the car, your bicycle, whatever, you came to work to do a good job. You didn't come to work to be turned into a crook. And that's what we did to those managers in that hospital that got itself into trouble. We did it because we frightened them to death. They were more scared of the consequences of admitting failure than of the actual consequences of failure itself. Now, I remember saying at the time, you know, wouldn't it be so much better if we had somewhere where a hospital said, you know, I've got real problems with keeping up with my chemotherapy targets. I could ring up somebody and say, has anybody got the same problem? Has anybody got an answer to my problem? Can anybody help me? Because we didn't do that. There was nowhere for anyone to go. So they ended up telling lies. And I remember standing on a stage the morning I was talking about it, and I said, wouldn't it be great? And it just sort of stupidly came off the top of my head. I said, wouldn't it be great if we had the Academy of, I don't know, Fabulous Stuff, where people could ring up and get some help? And the audience laughed, and I moved on to the next part of what I was talking about. But I came off the stage, and somebody came up to me and said, you know what, Roy, there is no repository of best practice in the NHS. Why don't you do it? And I kind of drove home and I thought about it. And at that time, I'd come across a really good website called the Apollo website, which was run by, guess who, the blonde Terry. And it was actually sharing best practice for specialist nurses. So I rang her up and I said, look, I've got this idea, the Academy of Fabulous Stuff, a website. I told her the story about the chemotherapy. And I said, look, I don't know how we're going to do it, but should we have a go? And she said, absolutely, we'll have a go. So we did. And that's how we started it. Now, it's important that you understand that, because the journey for us into sharing best practice occurred here. The journey was only 5 inches long. It was obvious that unless you show people what the good stuff is, then they'll just keep on doing the stuff that they're doing. And so we've sort of moved on from there. God knows how old the Academy is now, and God knows how many people have shared it on the website, and God knows how many people have benefited it, and how many people have helped each other. But so the journey for us was an attitude journey. The attitude that said, if you share the good stuff, you'll get better stuff. And so the journey really then, we transferred that journey to you. People like you are prepared to give up your lunch hour and listen to me talking about how to do the good stuff. And, you know, when you go home at night and you flop on the sofa and you use the best invention known to man, the screw top bottle of wine, and you pour yourself a large one and you think, God, I've had a hard day today, but I've had a really good day today. And you flop. And my question for you is, how do you know? How do you know you've done the best job that's possible to do when you're doing your job? The answer is you don't know. You don't know if somebody in the next hospital, in the next town, in the next region, in the next part of the country, the next place in Europe, the world, somebody doing your job isn't doing it better. And of course, the obverse is true. How do we know that you actually are the one that is uniquely different? And you are the one that absolutely is leading the way in whatever it is you're doing. And it doesn't matter what you do if you're the best at what you do, because unless we share what we do, we will never know. And there is no point in coming to work unless you want to be the really best at what you can do. And so that's really our philosophy, and that's where it all starts for us. And it's quite interesting. I'm going to just show you something here. You won't be able to read it, but just take my word for it. This is on Twitter this morning. Now, this is a kind of an organizational diagrammy thing from Virginia Mason on continuous improvement. And there are 6 steps to this continuous improvement. And I'm not, who am I to be critical of Virginia Mason? But I do know that the trusts that have been doing it have benefited from it, and they've all been very enthused about doing it. And I also know it's cost millions of pounds to do it, because the NHS or the Department of Health paid Virginia Mason to come over here and do it. And they've charged the earth for this. And they've been quite secretive, really, about what their approach is. And it is so bloody complicated. And so it's complicated and it costs a lot of money, and they haven't really been open with how they use their technique. And, that I'm just going to put that in a box, because that is not what I'm interested in. That is not what I want to do. What I want to do is find ways of sharing the good stuff that you do, because there's always a better way. And in management terms, I mean, if this is a management lecture, then we better do the the science bit, the serious bit. There is an approach where the performance of most organizations has a sort of level of median performance. Above that is positive, is a deviance, it's a positive deviance, and below that is a negative deviance. Now, there are 2 schools of thought. There are people who focus on the negative deviance. That's what the CQC do. They turn up and they look for things that are wrong. Above the line is positive deviance, and positive deviance is what we do at the Academy. Positive deviance, what does that mean? Well, it means that there will always be people who, given identical circumstances, money, challenges, time, people, resource, there will always be people who, because of their attitude and their approach to what they're doing, will find a better way of doing it. So what we are involved with is positive deviance. I'm not interested in what goes wrong. I'm interested in what goes right, because the more things we do right, the less we will do wrong. So, okay, so my task really is to talk to you about how we share these things that go right. And you know, I'm sure there are lots of scientific ways, but I can just tell you some of the things that that have happened in my experience, and you can think about them. I mean, firstly, if we look back on the experience of COVID, and the way in which people innovated during COVID, and I mean, a lot is being made now by the fact that people who were in COVID wards weren't able to talk to their relatives at very critical times during their illness. And there was one nurse who started this all off because she broke all the rules and she brought into work her iPad. And she said to people who are in desperate states and wanted to talk to their relatives, and she said to the relatives, give me your email address, I will do a FaceTime. You can talk to your relative. Now that broke all the rules, all the data rules, and she scrubbed their iPad down with disinfectant or whatever it was for infection control, and she allowed people to talk to each other in these disparate circumstances. Now, bless her, she put it on the academy. She shared the idea. Mwah! She shared the idea. Before you know it, there were people who were donating iPads. There were people who were doing it. People just copied it because it was such a good idea. So that was, you know, how did that idea get shared? Somebody thought, you know, this is not a bad idea. I'll share it. They said they would share it. It's the mindsets, the 5 inches. I'm doing something, I'm going to share it to see if it's good enough for other people to copy, or maybe somebody's got a better idea. And then we had a whole set of rooms that were set aside for people who were being very stressed, and so they'd set aside some rooms where they had some comfortable seating. I think there was a microwave, cup of there was a kettle and some cups and some tea and coffee, and then there was some nice smelling hand wipes, and the lighting wasn't the normal fluorescent lighting, and these were people who could kind of just go and sit and have a scream if they wanted to, or burst into tears if they wanted to. These were rooms that were really set aside for that, and that ended up on the Academy of Fabulous Stuff. And people shared that, and now they're quite common across the NHS. Something else that Terry and I do as well in the days before COVID, we used to travel around trusts, and in the course of a year, we used to visit about 20 hospitals, I think, in the course of a year. And we used to do something called a market square. And we used to say to people, right, every department could have a little table, we'll call it a market, and on the table they can do a display of the best things that people are doing in their department. Now you think, in their department, really? Well, you know, won't everyone know? Well, I'll tell you 2 stories. One is, and I'm sure they won't mind me telling you, one was actually at Bart's Hospital, where they put on one of these lunchtime things and people were showing their best practice. And it was fantastic. And Terry and I went round and we met everybody, we made videos, we put it on the website, we shared it on the Academy. And at the end, there was a big, tall guy left. He had a shirt on, stethoscope round his neck, and he pince-nez glasses, and his hands plunged deep into his pocket, and he was kind of round, scowling, had a very miserable face, this bloke, real miserable looking bloke. And he came up to me and said, are you Lilley? And I said, yeah, I am. He said, yeah. He said, and I'm going to swear here, so don't be upset, but I'm just going to tell you what he said. And he said, he said, I didn't realize we did so much good stuff. And he walked away. And I said to someone, who the hell was that? It turned out it was the medical director. The medical director hadn't realized how much good stuff there was going on in these marketplaces within the trust. So when we talk about, you know, the idea, the concept of sharing best practice, it starts with ourselves. It starts with an attitude that says, I want to share what I'm doing because I want to see if anybody's doing it better. That's the first thing. Secondly, it's sharing internally. It's having that attitude internally to say, okay, let's show each other what we're doing. Because the other part of the story, another hospital that we went to, we spoke to some people who had their table and they were showing their best practice. And I remember saying to them, what about, you know, whatever it was is the next step? And they said, oh yeah, well, we're not sure how we can do the next step. And we said, okay, fine. And then we did the tour of 20 desktops. And we said to somebody else, what are you doing? And they said, oh, we're doing this. And suddenly it dawned on me that the people here had the answer to what people were doing there in the same organization. So in terms of improvement, it doesn't have to be something you're going to put on the academy and change the face of healthcare globally. There's things you can do internally by showing each other the things that you're doing. And, you know, if you're in a managerial position and if you are any kind of a boss, you know, you can't run anything sitting behind a desk. You have to get out and you have to talk to people. I mean, this is a management lecture, I suppose. If I was going to refer you to read anything, you have to read Tom Peters. Tom Peters, his seminal work is a book called In Pursuit of Excellence. He talks about management by walking around and how important that is. But it's not enough just to walk around. It's what you do when you walk around. And if you go somewhere and you could say, how are you doing? What is there that we can make your life easier? Because you see, if you say to someone, how can we make you more productive? And I think we're going to have that productivity word in the NHS coming very soon, because you won't have seen Jeremy Hunt this morning. But, you know, if a nudge is as good as a wink to a blind donkey, then we're going to see some cuts, I think, in public services. And that means productivity. If you say to someone, how can you be more productive, particularly if you said it to a nurse who's just come off a 14-hour shift with no breaks, you'll end up with a black eye, and rightly so. But if you say to people, how can we make your life easier? Because if your life is easier, that means the work is easier. The work is probably safer, quicker, done better. So it's about the language, the narrative that there is around change. And the narrative that there is around this kind of change is very complex and it's very managerial. What we're interested in is the language around making change that is in the everyday language. So if I said to you, all of you here, people, you know, who we got, Fenny Johnson and Sharon Kidd and Kate Cheshire and all these other people, I've said to you, how do I make you more productive? You'd probably stab me. But if I said to you, what can we do? What 3 things can we do to make your job easier? What can we spend 50 quid on that will make it better here? And I remember saying that years and years ago now when I was running a hospital. I remember saying to the ward sister, hi, how you doing? She said, fine. I said, okay, come on in, tell me, what can I do for 50 quid to make your life easier? And she said, I don't need 50 quid. She said, I need someone to come and move the drugs cupboard from right down there to in the middle of the ward so we don't have to keep traipsing down to the drugs cupboard. So we got estates in, moved the cupboard, and I think it cost us 10 quid for a new lock. So it's about asking people. People, if you want to know what to do better, if you want to know how to run things better, you have to ask the people who are doing the job. It comes from the ground up. Now, I'm 2 minutes over my time. I've got, it's 12:52. We've got 8 minutes left. There's a shed load more, actually, that I'd like to talk to you about. In the little card that accompanies this 20 minutes, there is a few headlines about what I've talked about, but also there's a link. And if you click on the link, you can download a book. It's a book I wrote some time ago. You can have it with my compliments for free. It's called The A to Z of Management. And it covers a lot of the things that I've tried to talk about this morning. But you can have the book with my love. Please read it and then email me and tell me what I can do better, because unless you tell me what I can do better, I can't write a better book next time. So Terry, let's ask everybody to turn their videos on, and if you bring them after the question.
Come and say hello. Yeah. And also, as Roy said, if you scroll up in the chat, you will see at the top of the chat, past where everybody has joined, you will see your link to download your digital postcard, which I have to say, Roy slightly encroached and will be building on in more detail on his session on Wednesday, when he'll be talking around empowering staff to make change. So they link in very nicely. But if you scroll to the top of the chat, click on the link and you can download your postcard with your book. So anybody here like to ask Roy a question, make a comment, tell him off for saying the F word?
Paul always asks a question.
I'm going to have to prove you wrong this time, Roy. I'll quite happily sit and listen to everybody else.
Right, has anybody got a question? Has anybody here today at a trust that Terry and I have visited?
Yeah, Sharon. Sharon's here. And Sharon, I don't want to embarrass her, but Sharon is the lady that actually told us all about the iPads and made it kind of nearly break the internet. So that's fabulous. Sharon did that. And I think, Sharon, I don't know what's wrong with your camera, but either you're in the middle of a kind of power outage and the lights are going on and off, or what, I'm not quite sure. But anyway,
that's better. That's stabilized
yeah.
now. Yes, it was Sharon I was talking about who came up
Yeah.
with the idea of using the iPad, and of course that's now is so ubiquitous that everywhere you go people are doing it. So that was born of, can you imagine if someone had said, well, look, during COVID we got this idea that we're going to use iPads so everybody can have a FaceTime with their relatives. Somebody said, oh well, we'll have to do a business plan, and then of course is the data protection, and then there's the GDPR, and then there's the infection control, and before you know it, some numpty somewhere or other has written a business plan with 10 options and nothing ever got done. Sharon turned up with her iPad and did it. Now we all do it. Well done, Sharon.
And we still use them.
You're still doing it, yeah.
Still doing
and the public thought it was a great idea because they donated a lot, didn't they, as well?
Yes, they did. iPad holders, iPad cases, iPads. They had charity events to raise money for more iPads. But our IT team were brilliant. We just went and asked them. And
you see, here's the thing. What Sharon did, I mean, clearly it was a great idea, but she needn't have shared it. She needn't have said, this is what I'm doing. She was brave enough to say, this is what I'm doing. Do you want to do it as well, or do you want to find somewhere that's doing it better? It's up here. It's the attitude of mind about, I want to do what I'm doing better. Is there a way? And that is not I mean it's not an easy thing to get people to do in a business, if I can call the NHS a business, in a business that is not well known for having that sort of open attitude of mind, which is why I think it starts with whoever's running your department or whoever you're working with. You don't have to be the boss. If you sit down with some 3 or 4 people and you're all working on something, and you can say, how do we do this better? Is there somebody doing this better? It starts with a curiosity. So if it's anything, it's about curiosity. Is there a way of doing this better? And I really don't think, we see enough of that. It kind of gets drummed out of people. This is the way things are done here and all the rest of it. It doesn't have to be like that. This is where, we have positive deviance. These are people who, under any set of circumstances, will find a better, faster, quicker, safer way of doing what they're doing. It's an attitude of mind. And that, I'm afraid, comes from the top. A lot of it is about the culture of organizations. You can't change culture, but you can change the environment within which people work. And if you are a boss and you walk around and you say to people, you're doing a great job, any ideas how we could do it better? That's the kind of narrative. You have to set the narrative for change, and you have to set the openness for change, and you have to set the attitude of mind. If you get those openness and attitude of mind together, and you get that narrative, then frankly, you do not need to give Virginia Mason reputedly nearly £10 million to sort out 3 or 4 trusts, because you can kind of do it yourself. It's common sense.
Roy, I've got somebody who's sent me a text message, because I think they're on their phone, not the computer, saying what she started doing within her trust. And I think obviously this is somebody that maybe is the matron of 4 or 5 wards, is asking people what the challenges are, what they'd like to change, what would make their services run better. And then she says, I come onto the website, I find other people that have done something similar, and I share other people's solutions. We then have a discussion, and we take bits from maybe 2 or 3 other people's solutions, and we try that to work for our department. Yeah. And she's saying it really is, don't start with a blank piece of paper. Pinch with pride, start with somebody else's solution, which may not be 100% right for your area, but 70% of it is right, and you can start with that and build your own nuance. Yeah. So she's even used our hashtag, bless her, thank you, pitch with pride.
Pitch with pride. I don't know who you are,
so thank you.
I love you. Well done. And thank you for saying that. I mean, there's no doubt about it. It is an attitude of mine, and I you know, as much as I don't want to get tangled up with these big organizations who come in with this kind of toolkit for innovation and all the rest of it. I really just think that it starts with, everybody watching here today, the 100 or so people, or whoever it is that's watching. The people that I hear today, you can all go back to where it is you're working and sit down and say, what would make our lives easier? What could be different? And if you say to people, how can we do things better? They'll say, I'm doing the best I can, bugger off. But if you say to somebody, how can we make life easier? How can we make this job easier? Then that is a brilliant opening conversation piece to say, and people will tell you that. But if you start conversations about productivity and things like that, you'll have difficulty then in getting a narrative open. Sorry, yes, Sean. Where, Terry?
Yeah, Roy. So Donna has said, and it's basically around the first session we had this morning, was she's saying, how do we bring patients and people in together as well, Roy? So not just staff, but so that if we have true co-production. So Donna, the session we had this morning.
We're close up against the buffers of time, so I'll answer that very quickly. It's Donna O'Brien, is it? Hello, Donna. Thanks for your question. You're absolutely right, but I tell you what, the simple thing is ask them. Because we have several little sayings at the Academy. Pinch with pride. The little things are the big things, and the one I major on is start with the patients and work backwards. And this, I've worked in industry. I mean, I'm an old geezer now, and I'm probably on the way out. But I've run all kinds of businesses in all kinds of countries and all over the place. And this is the only business, in inverted commas, I've been in where we don't ask the customer. It's bonkers. Everything else I've ever done has always started, you go to the marketing department, we want to sell this. Well, they say, okay, well, let's ask the customer. You go to the engineering department, this break, we'll ask the customer. We don't ask the customer. And when people leave our services, I know we've got this daft thing about the net whatever it is score of how was it for you, and would you recommend this hospital to your uncle? Well, it doesn't really matter because if it's the only hospital in town, there's no point in doing it. But there are things that you can say, and you could get the people on the wards to ask those questions. You don't have to say, when people are leaving, if somebody came up to me and said, Mr. Lee, I'm so pleased you're going home. Hope you enjoyed your stay with us, and as much as you can. Is there anything we could have done different? Ask the staff to ask the customer. Is there anything we could have done different? Yeah, you could have stopped banging the bins at night. Let's buy some soft closing bins. It is not difficult. You will get organizations that will take a lot of money from you, and they will put you through all kinds of hoops. But at the end of the day, if we want to run good services run by good people, then you have to ask good people what they would do differently, and you have to ask the people who've been the recipients of the service, what could we do better? And I just think that, you know, if we train people to do that, at the end of it, when people are leaving, we'd find out all kinds of stuff. It's a bit like exit interviews. You know, 40,000 nurses left prematurely the NHS last year. Nobody asked any one of the 40,000 why they left, because we don't do exit interviews. Bonkers.
Right, Roy, final message, and then we have to go. What's your parting gift?
My parting gift is 5 inches. It's about you. It's about, if you've got to be genuinely inquisitive about, can you do your job better, differently, faster, safer, whatever it is, what can you do differently, and share the things you're doing. Like Sharon shared her iPad idea. Somebody else might have had a better idea, but she said, you know, here it is. This is my first go. This is my first deal. And this is what we're doing. So it's about the willingness to share and asking the questions. What can we do to make life easier for us all? You do that and you'll have the answer to all kinds of productivity entangles that people get themselves into. And thanks for tuning in.
Thank you, Roy.
Don't forget, download the book. It's free.
Yeah, perfect. Well, thank you all.